In nursing education, clinical site visits are often viewed merely as a logistical requirement for accreditation and student evaluation. But an essential question remains: are these interactions truly empowering preceptors? And is there a direct relationship between the structured faculty support and improved patient care? As the complexities of the clinical environments and virtual constraints continue to grow, how can nursing programs move beyond inconsistent observations to intentionally create standardized, flexible frameworks where educators can confidently guide and learners can truly thrive, not just perform? Welcome to Teach Well, Learn Well, a podcast series highlighting the scholarship being published by members of the University of Tennessee Health Science Center's community about effective ways to teach. I'm Tom Lochner of UT Health Sciences Teaching and Learning Center. Each month, we interview our educators about their research and its impact on the higher education community. This month, I talked to authors of an article titled Optimizing Advanced Practice Registered Nurse Critical Site Visits with a Standard Operating Procedure, published in the October 2025 Journal for Nurse Practitioners. With me today are three faculty from our College of Nursing. Laura Reed. Welcome, Laura.
Good morning. Thank you for the invitation. I'm happy to be here.
Glad to have you. Sally Humphrey is also with us.
Good morning, Tom. Thanks for having us here today.
Thanks for joining us, Sally. And finally, Bobby Bellflower. Welcome, Bobby.
Hi, Tom. Thank you for inviting us. We're excited to participate in this endeavor.
And I'm excited to have you. And I found this article fascinating. So let's just start out. And can you briefly summarize your paper and talk about why this topic is important to you?
Well, Tom, the idea started when we were in one of our Doctor of Nursing Practice, or DNP meetings. We have monthly meetings for our faculty, and we discuss these things. And as part of our accreditation, site visits are required. But we were all doing site visits differently. Some were in person, some were virtual, and there was no procedure to specifically follow. And many had questions. And we also had difficulty making sure that everybody had conducted a site visit at least once a semester. So we decided during our meetings that we needed to develop a standard operating procedure for site visits. But because we have 9 different concentrations within the DNP program in the College of Nursing, we needed to make this very flexible. It took a lot of hard work, but we did do that. Why is the topic important to us? It's important, number one, because it's a vital part of our accreditation status. And we have to be able to prove that we have visited our students in the clinical sites, and we have talked to their preceptors, and we have assured that preceptors and students have a good match and that they're in an acceptable learning environment. And that's part of what the site visit is supposed to do. But while we were developing some of the parameters for the site visit, we realized there was a lot more involved in a site visit than just making sure that the student was in the clinical site, that the clinical site was appropriate for the learning activities that the student needed to do during that time. So it turned into a major project. During our meeting, I asked for volunteers, and then Sally and Laura volunteered to lead this project, and they did a wonderful job.
After the COVID pandemic, site visits were changing. Before the pandemic, we did all of our site visits in person. And then after the pandemic, we transitioned to doing some of our site visits virtually. But in that time period, the clinical faculty, there were a lot of questions and new faculty. And so we knew that we needed to clarify the process and what was expected of our faculty members.
I expect that presented a lot of challenges to go from a physical visit to a virtual visit. And I can imagine just the sense of what was going on probably became a lot more challenging.
Absolutely.
You're right. It really did. And part of the fact is that some of our site visits require the students to demonstrate physical examinations and specific task and learning activities that they do in the clinical area. And that's very difficult to capture in a virtual site visit. So we had to be very creative in trying to capture the specific things that some of our concentrations need to do on a site visit.
So, can you talk a little bit about what an advanced practice registered nurse is and what are the challenges with them?
Advanced practice registered nurses are registered nurses who have been educated at an advanced level. We have been trained to assess, diagnose, treat, and follow up patients in various clinical settings, anywhere from neonatal to acute care, geriatric patients, family practice, primary care, acute care peds. But we are able to assess a patient, treat a patient, diagnose. We can do everything. We are aware of our scope of practice, that if we have patients that are too complicated or we need assistance, we do collaborate with our colleagues in medicine or pharmacy, or if we need help in specialty areas. But the challenges that come along with the site visits, as Bobby and Sally stated, is they are required by accreditation, but we cover in our 9 programs 9 different types of clinical settings. So we can be anywhere from a community clinic to a hospital setting to an ICU. And we also cover a 3-state area. Most of our students come out of Tennessee, Arkansas, and Mississippi. So that provides also travel issues that we have as faculty trying to get to see all these students. We need to see what our students are actually doing in the clinical setting. Our preceptors are great and we trust them 100%, but sometimes we need to lay our eyes on them to see what they're doing, and to also physically see what our clinical sites look like. Are they an appropriate site for our student? Are they seeing the types of patients that they need to be seeing in the clinical setting? So going out and doing the site visits allows us to physically to see the site, see the student, and also gets us to continue to make our relationships with our preceptors and to help strengthen them. And we're able to provide our preceptors with resources they may need, such as continuing education, or even encouraging them to come back to get their DNPs if they're still at the master's level. So we do provide them resources as well as going out to see our students and to assess our students in the clinical sites.
So, talk a little bit now about the standard operating procedures, or the SOPs, as you refer to them in your article, and how these standard procedures help with those challenges.
Yeah, so standard operating procedures are used in a variety of different fields and can often be pretty prescriptive. The way that we envisioned using a standard operating procedure was to provide more of a standardized framework for our faculty members to understand what is involved in the site visits. Like Bobby said earlier, we did not want to make them just incredibly prescriptive because each of our concentrations and require slightly different things for their site visits. So instead, we created this framework that allows some flexibility, but also lays out the most important points, clinical visits. And also, standard operating procedures can help in the quality improvement portion. And so we are looking at this from a lens of, we want to continually improve our processes here at the College of Nursing. And this will allow us to have a good framework and a place to kind of move forward with that.
So, tell me this if this is a bad metaphor, but as you're describing it, I'm thinking about when, those very stressful times when I've had to go shop for a car. And I always want to make sure that I have a list of questions to ask and things to look for as does this car do this and does it have that? And how does it do this? And what's the performance on this and stuff like that? Is that similar to what you're talking about?
Yes, yes, absolutely. Absolutely. We included the things that were most important to cover. So that is discussing the clinical performance of the student with the preceptor, establishing kind of that face to face communication with both the preceptor and the student. And we even included things like what to do before your clinical site visit, like establishing the communication, making sure that you have a clear time and date set, making sure that you have made any preparations for travel, which includes maybe even hotel if you have to go out of town, that type of thing. And then the follow-up for the clinical visits was also included. That includes all the documentations that is necessary and follow-up communication.
So you talked about that these SOPs aren't necessarily prescriptive, but I assume that maybe it's a combination of some things that have to be done on every visit and some things that you have a little bit more flexibility for. Can you talk a little bit about what the differences are and where you might provide some flexibility?
Right. And that was a real struggle for us. The SOP does provide the ability to be flexible depending on the concentration. Some of the differences would come in if we talked about going to a mental health site visit. That's usually in a clinic setting. It can be via telehealth, but when the faculty goes to visit the student and the preceptor with psych mental health, they are not allowed to observe the session with the patient because that's a confidentiality issue. And first and foremost, we want to make sure that the patient comes first. So, because of the confidentiality issue, the faculty cannot do a close observation of the student and patient. But we have seen the clinic set up. We know how it works. You can observe the interaction between the student and the preceptor. You can observe the interaction between the student and assistants in the office, and that's very helpful. On the other hand, for our adult gerontology acute care students who are in either an ICU or hospital setting, those students, when we do the site visit, are required to do a head to toe physical exam, and they have to meet a specific checklist. And the faculty has to be in the room with the student. The student has to talk through the physical exam. So that's a hands on observation that the faculty has to make. And it's very difficult to do that specific site visit virtually because you have to make sure the student meets all of the parameters on their checklist. So we had to build that flexibility in. So one standard operating procedure that's very prescriptive would not fit all of our concentrations. Another example is when we visit our neonatal nurse practitioner students. When we do that, we make rounds with them, which takes 2 to 3 hours on a daily basis. So you observe the student interacting with the patient's family, you observe the student interacting with physicians and pharmacists and OT and PT, and you want to make sure that they can do that. So you can see how the different concentrations require different aspects of a site visit. The other aspect is communication is so important, especially in dealing with families. And so we also want to make sure that our students are getting the opportunities to actually deal and do hands-on patient care and family care. And it's difficult to see that unless you do an on-site or in-person site visit. The other thing I did want to mention is that our faculty, by our accreditation standards, faculty are required to give students a grade. And in order to do that, you have to have some interaction within the clinical site. So that's why we are so adamant about every student and every preceptor having the opportunity to have a site visit.
Bobby, thank you for sharing that. I'm a guiding principles sort of person, so I was really appreciative of the fact that you also talk about guiding principles. And I found the ones that you included in your article really interesting. You talked about quality assurance, you talked about support and guidance, performance evaluation, feedback and improvement, interprofessional collaboration. Have you found any of these to be especially important in structuring your site visits?
Yes, I really think the support and guidance is one of the most important principles. And as Bobby was saying, as clinical faculty, we are responsible for assigning grades to our students for these courses, for these clinical courses, but we aren't the ones that are there with them in the clinical site on a day-to-day basis. That is their preceptors. So being able to make the clinical site visit and have that opportunity to give both the student and the preceptor the support that they need, the guidance they need, and also be able to see what is happening in the clinical setting is vital. The preceptors give us feedback in the form of evaluations throughout the semester, and that is also important. But actually, again, being able to see the interaction between the student and the preceptor, see the clinical site and what is actually happening there is key. So I think keeping that kind of thought in our minds that the whole point of these clinical visits is to provide that guidance and that structure for both the student and the preceptor.
What strikes me when you say that is, as much as technology has helped us with a lot of things, that human connection is always first and foremost very important still. Yeah.
Absolutely.
Yes. And Tom, one of the other things that I have found that has been very helpful since we've implemented the SOPs for site visit is that feedback and improvement process. Some of our preceptors were not comfortable or didn't really know how much feedback they could give the student in real time. And some of them were not comfortable giving feedback that told the student they needed improvement. And so part of the SOP was that we help teach our preceptors how to give feedback in real time to the student, and that it's okay to give them feedback that says you need improvement in this area, and this is how we can achieve that improvement. And so that's been very helpful. Laura may talk about this in a minute, but she was part of developing a video on how to give appropriate feedback in real time to APRNs and APRN students. And so we do provide them with the ability to watch those videos and to get CEs as part of that. But I think that's been very helpful. And maybe doing the site visit, it helps to empower the preceptors to give appropriate feedback.
Yeah, that feedback is not only important, but it's also critical, right? I mean,
Yes.
we do a session in the TLC that talks about how if you don't give that critical feedback, you're potentially putting patients' lives in danger.
Right.
And so you've got to get it to a point that no matter how hard it is to do it, that you've got to.
Right.
Yeah.
So that was a great segue when you're bringing up preceptors, Bobby, because I'm interested in other challenges that preceptors have. What challenges do preceptors bring to implementing these SOPs?
Well, a lot of time it is just getting them to give us a time or for us to go and meet with them. It's a little bit easier for those of us that do site visits in acute care facilities like hospital systems because they're open 24/7 and we know that there are providers there 24/7. Unlike in some of our primary care clinics and our outside clinics, especially those that are owned and run by the preceptor themselves, they may take a day off, it may be a holiday, they may not want us there that day for various reasons. So sometimes we find that we run into some challenges of getting visits scheduled. They may be convenient for us to go on a Monday, but it may not be convenient and that preceptor may not want us in the clinic on Monday. I know some of the family nurse practitioner community visits I've had to do, I've had to work around their lunch period. It can be distracting for us to be in the clinic because they've got a visitor, so they're on their best behavior. And then we need to talk to the preceptor, so we take the preceptor away from a patient time. So one preceptor who just happens to be a good friend said, "You're costing me $1 by coming in, you're taking me away from a patient, and a patient is money in the primary care setting." So we have to structure our times so that we are respectful of what's happening in the clinics, as well as being able to go out and do what we need to do and to assist the preceptors with the information and to get the site visits done that we need to get done.
I imagine that even in the hospitals, that those places are crazy busy. So that probably provides a challenge as well, trying to get people to have time with you between patients and just running from one thing to another.
True. And they're also used to walking and talking at the same time. So having them just give you a minute in a room where you can have some time to talk about what's going on with the student, what kind of feedback, what are they seeing that we need to know about as the educators, and what can we do to help them. Sometimes it can be a challenge as well. You're right.
So you talked about the challenges that preceptors have, but overall, are they receptive to these SOPs?
Yes, they are. One of the benefits to the way we design the SOP is that there may be clinics that we've known the preceptor for and ever. They've precepted for us for many years. We may be able to do that in a virtual visit where we can Zoom with them or have a Teams meeting or a phone call and assess the student that way, because there's a preceptor and a site that we use frequently, so we understand and know what's happening in that site. And unless we have a question about the student, then we wouldn't have to physically go out. But they are receptive. I think they're glad to see us when we come. We typically don't go empty-handed, so we usually take some kind of a little happy or a trinket. Sticky notes and ink pens are everybody's great friends. So we always try to make sure that we take them a little happy, but I do think that they like to see us because they like to have the conversation. They like the connectivity between faculty and them that gives them a connection, and it makes them feel that they have a valued relationship with the college.
So speaking of faculty, are the faculty receptive? How have they responded?
Well, anytime there's anything new, we tend to have some little pushback, but I think
So
overall,
change.
yes, change is hard, but we were all struggling at a program as faculty on how to do these site visits because we were all having to do them so differently. So I think giving us the guidelines now that says this is the way you do it, it's much easier for us to be uniformed and be consistent with the way we're doing the site visits across the programs. One of the unique things about our program is we have dual programs. We have dual FNP psych, dual FNP acute care, and dual primary care peds and acute care peds. So we actually have 6 groups of students who are sharing different programs. And it's much easier now for them to understand that the same way they get a site visit in their primary care clinics is the same way they're going to get a site visit done for the acute care or the psych. So it allows the students to have a more consistent approach to what's going to be happening in the clinical settings. So I think faculty change was hard and we had a few bumps, but we've all adjusted and I think it's going much better now.
In your article, there's a sentence. I just want to read this sentence and have you respond to it. It says, by standardizing clinical site visits, this SOP aims to enhance the overall quality of clinical education and improve student outcomes in advancing nursing practice. Have you seen that happen?
Yes. Yes.
And how have you been able to see that?
Well, I think we're able to conduct better, more standardized clinical site visits. So we're all going out looking for the things we need to be looking for. And we're all now documenting and able to address more consistently. If we see an issue or an area that needs improvement, we're able to handle that. And I think we are all, and all 9 programs are now seeing and doing the same process. So therefore, overall, our practice is improving.
And you're seeing it in student performance and how they're working with patients and working in the clinics that
Yes.
better quality, higher quality.
Yes, and I think part of that is that it's helped to improve our communication with our preceptors as well, and then that in turn helps the students. And so we are certainly seeing better performance with the students as well.
Wonderful. Beyond nursing, health sciences encompasses a lot of very different disciplines. So how might the work that you've done with the APRNs and your standard operating procedures apply to other health professions?
Some of the other health professions also have students that are in many different areas at the same time. And having to do clinical site visits is important for them too. I think probably the most important aspect from our SOP are the guiding principles: quality assurance, supporting guidance, performance evaluation, feedback and improvement, and the interprofessional collaboration and communication. These are the specific guiding principles that we used, and this is what was in the literature. This SOP is very literature based. So I think all the other professions can use those guiding principles to develop their own SOPs that are specific for their area. And again, as we talked about, feedback from the preceptor, feedback from the faculty is so important. And using these guiding principles to provide that feedback to students and to preceptors is important to the student, but it's also important to patient outcomes. Patient outcomes depend on how well the student is educated and on how well we can assure that the student can meet the competencies that are required for patient outcomes.
Yeah, it all comes down to making sure that our patients are well taken care of.
Yes, yes.
So you've got this paper. It's a wonderful paper, and you've talked about outcomes and how it's improving student experience and patient care. What's next?
Well, first and foremost is just making sure that we're continually evaluating how the standard operating procedure is performing and making adjustments as needed. So our committee will continue to look at how it's doing, how faculty and students and preceptors are responding, and take feedback from them and make changes as needed. We've also worked on developing a dedicated preceptor portal that contains information that's important to the preceptors, and that includes opportunities for free continuing education. As Laura and Bobby mentioned earlier, links to the preceptor modules that help kind of walk through difficult situations, how to provide feedback, that type of things. And of course, links to the TLC modules, the clinical education module in particular. And then also just recently, this is kind of an offshoot of this in the pediatric world, which is my specialty. We're actually working with our preceptors at ULPS and Le Bonheur to improve that communication with the preceptors and help to enhance their communication and feedback with students. We have a task force that we're developing, and I think that's going to be helpful to take that information that they're giving us and apply that to all of our concentrations. And one of the things that we have on our agenda is to discuss the clinical site visits and really have some rich feedback from our preceptors on how it seems to be working and what we can do to improve that process.
Any closing thoughts?
We have found this to be very helpful, not only for our accreditation status, but it's very helpful to keep all of our concentrations organized, to keep the information in a standardized format while providing flexibility for what is needed in each concentration. So we're very pleased how this has turned out. And it's not just, like, as you said, a one and done. It won't do us any good to say one and done. We will continually tweak it, change it, adapt it to what's needed in our specific concentrations, and move forward. I'm looking forward to our preceptor feedback, and maybe the next paper we will focus it a little bit more on preceptor status.
Oh, interesting.
Mhm.
Well, very good. I appreciate the time that you spent with me today. As I said, really enjoyed this article and thank you for sharing it. Everybody have a great day.
Thank you.
Thank you.
And that's this month's episode of Teach Well, Learn Well. I'm Tom Lochner of the Teaching and Learning Center at the University of Tennessee Health Science Center. Until next time.